Hey, it's Dr. Karen with this week's Hot Topic. Make sure you like this video, subscribe to our YouTube channel, and follow us on all of our social media so you never miss another hot topic and all of the other cool stuff that we do. So today I want to talk to you about stress. So stress is your body's reaction to a challenge or demand that requires an adjustment or a response. So it can result in either emotional, mental, or physical changes. And it's really our body's way of protecting us. So what happens to our body when it's under stress? So first thing, the amygdala sends a distress signal to the hypothalamus, which is the control center in your brain. Then the sympathetic nervous system activates, so it has the body release a flood of stress hormones, adrenaline and cortisol. Your heart pounds faster, our muscles tighten, our blood pressure rises, breath quickens, and senses become sharper. So this happens every single time. So the human body is designed to experience stress and react to it. So stress can be positive, such as like getting a job, promotion, being given greater responsibilities, keeps us alert and ready to avoid danger. So our body responds to stress by releasing these hormones, which increases our rapid heart rate and breathing so our muscles can respond. But if your stress response doesn't stop firing, and all these stress levels stay elevated for a long time, and it's not necessarily for survival, it can actually take a toll on our health. So chronic stress can have a variety of symptoms and affect our overall health and well-being. And some of these symptoms might include like irritability, anxiety, depression, chronic headaches, and insomnia. So today I have 5 areas in the body that take the biggest hit when we have chronic stress and why it's super important to control our stress levels. So the first one is our central nervous system and our endocrine systems. So our central nervous system, or our CNS, is in charge of this fight or flight response. So that's the stress response. So in the brain, the hypothalamus gets the ball rolling, tells your adrenal glands to release the stress hormones, adrenaline and cortisol. Sound familiar? And then these hormones start to rev up your heartbeat. They send blood rushing to the areas that need it most in an emergency, like our muscles, our hearts, and other important organs. And when this perceived fear is gone, the hypothalamus should send the all systems go back to normal. But if the CNS fails to return to normal, or if the stressor doesn't go away, this response just continues all the time. So chronic stress is also a factor in behaviors such as overeating or not eating enough, alcohol or drug abuse, and social withdrawal. Number 2, so respiratory and cardiovascular system. So stress hormones affect our respiratory and cardiovascular system because during that stress response, we start to breathe faster in an effort to quickly distribute more oxygen-rich blood to our body. And if you already have a breathing problem like asthma or emphysema, stress can make it really hard to breathe. So when you're under stress, your heart also pumps faster. So stress hormones cause your blood vessels to constrict to divert more oxygen to muscles that you'll have more strength to take action. But this can also raise your blood pressure. Hence, you have frequent or chronic stress can make your heart work too hard for too long, and then your blood pressure, and then you have a risk for heart attack or stroke, which is not good. So number 3, the digestive system. So under stress, our livers produce extra blood sugar or glucose to give you that boost of energy. And if you're under chronic stress, our bodies may not be able to keep up with this extra glucose surge that we get. So chronic stress can increase your result of developing type 2 diabetes, and this rush of hormones and breathing and increased heart rate can also upset your digestive system. So you're more likely to have heartburn or acid reflux thanks to that increase of stomach acid. So stress doesn't cause ulcers, which most people are like the H. pylori. That usually does, but it can increase your risk for them and cause existing ulcers to act up. So stress can also affect the way food moves through our body. So it leads to diarrhea or constipation. You might have a little bit of extra nausea or vomiting or stomach aches. Number 4, muscular system. So our muscles tense up to protect ourselves when you're injured, when we're stressed. So this tends to release again once you relax. But if you're constantly under stress, your muscles may not get the chance to relax. So you get these tight muscles like eating your shoulders, which cause headaches, back and shoulder pain, and overall body aches. Hence why you see a chiropractor. So this can set off an unhealthy cycle as you experience, and you turn to pain medications and all other things you shouldn't be doing. And the last one, sexually and reproductive system. So stress is exhausting for both our body and our mind, and it's not unusual to lose that desire when you're under constant stress. So short-term stress may actually help men to produce more of the testosterone hormone, but this doesn't last, obviously, most people know. So if stress continues for a long time, testosterone levels can begin to drop. So this can interfere with sperm production, cause erectile dysfunction or impotence, nothing any guy wants. Chronic stress can also affect the male reproductive organs like the prostate and the testes. And for women, it can actually affect our menstrual cycle. So it can lead to irregular, heavy periods, scanty periods. All those things can actually produce some physical symptoms of menopause, which if you're not ready for menopause, that's something you don't really want to get into. So as you can see, the stress response happens no matter if it's good or bad, but if it's there all the time, it can really wreak havoc on our systems. So if you find that you're super stressed out, make sure you don't just blow it off like it's not a big deal. Stress is super important to make sure it's under control. There's a lot of different ways that you can use to control stress. Chiropractic works really well. Acupuncture works well. Meditation, massage, essential oils. There's a lot of different things that you can do. Just Google it. There's a lot of stuff out there. So hopefully you found this helpful, and hopefully you don't find yourself having some of these signs and symptoms that you realize you're in stress overload. The good news is we can help you out. That's all I have for you guys today. I will see you guys next week.